favorite myth or trick for getting pregnant? From personal trinkets and statues to rose quartz crystals and smoothies. If you're crazed to conceive, nothing is out of the question. Now it's time to separate fact from fiction. Please welcome the doctor known as the God of Fertility and the best-selling author of Secrets of Longevity, Dr. Mao. Welcome, you're the man.
Hello.
Pleasure. Pleasure. Thank you for being here. Okay, what are some of the crazy things your patients have tried to do in order to get pregnant?
I had one that put an egg under her bed when they, try to conceive, and also eating pomegranates. I had a patient whose teeth were so stained from eating, I think she must have eaten 5 or 6 a day for about a month straight.
So that doesn't work?
Well, I mean, vitamin C, and that's antioxidant, so it's good for you, but it hasn't really been shown to be effective for this. But
you have been pretty effective in helping people that are having trouble getting pregnant in conceiving.
Yes.
What are some of the things behind us?
We have dang quai, which is an herb commonly used to help balance the hormonal system. You see, what happened is when you're trying to get pregnant, there's 5 areas that we optimize for our patients. One is you've got to have hormonal balance. PCOS, that's a hormonal imbalance. We talked about insulin resistance, right? So in other words, when you eat, your body releases insulin. The insulin is supposed to take the sugar out of the bloodstreams, but no, in your case, if you have insulin resistance, your body doesn't take the sugar out of the bloodstreams.
So isn't that being diabetic?
Insulin resistance is the cause of type 2 diabetes.
Okay.
So what happened is that, so the body goes, whoa, there's too much blood sugar. Let's take it and let's convert it to fat. So here you are, you're eating and you're still hungry. The cell's sending signals to the brain saying, hey, I'm still hungry. And the brain says, but I've just sent you food. So the craving comes up. So you keep eating, you keep converting to fat, and you don't get fed. So then you create an enormous hormone imbalance. So one of the most effective things for that insulin resistance is something very common: cinnamon. Cinnamon has been studied to help with glucose balance in the body. So we use this to balance blood sugar.
Okay, through herbs that you give your patients.
Herbs and acupuncture as well. Okay. Romania, it's for lining. This is kind of interesting. It looks like an Oreo cookie.
It does, but it doesn't taste like it.
It doesn't taste like it, yeah. And one of the things that I think has been overlooked is stress. Stress is probably the silent factor in a lot of infertility.
Which makes a lot of sense because, and imagine the women that are struggling and the couples, the stress level goes way, way up when they're not each month that goes by, right? Well, I know you look at people's tongues, correct? To see what's going on. Right. And so we wanted to pull Janelle up. Will you look at her tongue and let her know if there's anything you see? Come on up,
Janelle.
Did you just have an Altoid like me? No. No?
Nice to meet you.
Okay. Because we're doing everything in our power to get this girl pregnant.
All right. So in Chinese medicine, Chinese medicine's been very effective. I mean, we have 1.4 billion people to prove it, right?
That's right.
And so we've been at it for a while. So one of the diagnostics we do is we look at the tongue, because everything shows up on the tongue. It's like a map to the human body. So let's take a look. All right, so we get teeth marks, see? Ridges right there?
Yeah.
So tongue's swollen. So she's retaining water. So right away, there's puffiness. So kidney might be an issue, as well as hormonal system. There's imbalance that can cause water retention as well. So based on the tongue, so we look at the map. What we can do is then corroborate with listening to the pulses. The energy flows and courses through the pulse. So one thing I want to also tell you is that acupuncture has been studied in the last 10 years for infertility. And we actually co-created a protocol that was demonstrated to increase live birth success rates by 40 to 60% during IVF procedures. So I know, Dr. Potter is going to, help you through this process, and actually we worked with their group as well. So will you help her too? We're happy to offer you free services while you're going through this process.
Yay! And may I say you have the best bedside manner. That voice of yours is very calming and soothing, don't you think?
Absolutely.
Even though your tongue is puffy.
Yeah. Well, let's look at yours.
You want to look at my tongue? All right. I'm not looking to get pregnant.
You're not.
I'm done.
But how about a little, age reversal?
I would love to reverse the aging process. So you know what? I'm going to take a quick break. Will you do it during the break?
Well, if you like.
I would love it. Well, we could chat, but I just have to go to break now. But I'm happy to share the results with all of you. When we come back, it is your turn to ask your fertility questions. Get them ready, people. We'll be right back. Welcome back. We've been talking about fertility this whole hour, and we have May here. You are friends with Stacy, our producer.
Yes.
Please share your story very quickly with us, because it's a cautionary tale.
Yeah. Well, 2 years ago when I was 37, I found myself single and surprised about it. So I did the one thing that I thought I could do to take control of my fertility. I froze my eggs. And that process, I felt very blessed, went really well. I got 18 eggs and then met the love of my life and got married. So there was a happy ending. We tried for a year to conceive, and we've been unsuccessful. So just last week, we decided to go forward with IVF using the frozen eggs. And in shipping down from San Francisco to Los Angeles, all 18 were destroyed.
Oh my gosh.
Yeah.
Oh my, something with the packaging? It wasn't packaged correctly?
Yeah, they were mispackaged. So when they arrived in LA, the doctor opened up the crate and they were just a jumble. So I say they were my scrambled eggs.
Oh my goodness. So what is the next step for you?
The next step is to go through IVF using the eggs I have now. Fortunately, I'm just about to turn 40, so we still have a good chance and we're very hopeful.
Oh, we're hoping for you. Thank you so much for sharing your story and being with us. You wanted to say something. You have a question? Hi.
Hi. I wanted to know, when do you realize that you've had enough and you just stop?
When you have a desire to be a mother, it's not a matter of whether or not you are going to succeed. You will succeed. It's a matter of how. I mean, there are many paths to motherhood, and none of them are impossible. It might not be motherhood along the path that you would have chosen, but you will succeed ultimately if you're open to, adoption, egg donation, embryo donation, gestational carrier surrogacy. All the parts in the reproductive process that might be faulty can all be replaced, rented, bought, borrowed.
Thank you. Yes.
I just have a comment. I just want to tell folks like Janelle and anyone watching that IVF can seem so scientific, and it's not. It's amazing. It's a gift.
Thank you. Thank you. Thank you. Good luck. Thank you to all of my guests for sharing their very personal and courageous stories. Special thanks to Sarah Cannell, Dr. Potter, Trent, Dr. Mao, and Rosie Pope.